I'm Jennifer Newell, the founder and CEO of Betty's Co. Betty's really is this perfect combination of two facets of my life. One is my personal life as a patient. So when I was 17 years old, I was diagnosed with a condition called premature ovarian failure. This condition causes infertility. I never started a period. And I was thrust into this new world of women's healthcare as a person who cannot become pregnant, but is a high user and has a high need for these services. And unfortunately, my experiences were predominantly negative, and it took about 5 or 6 years for me to get a hold of my condition. Through that, I was able to really understand my anatomy and how my female anatomy works. I was able to learn how to advocate for myself as a patient. It taught me early on so many things about engaging with healthcare and being responsible for my own healthcare that most of my peers didn't start to learn until they were undergoing their own fertility and pregnancy journey. 17, I was diagnosed. Fast forward 5 years, and I stumbled into a career in healthcare. 2017, early 2017 happened, and a light bulb went off, and it said, women's health has not changed. We're still having these same conversations about women's health care. What are we doing wrong? And I did research and I found this really, really big and kind of obvious gap in how we as healthcare providers, serve younger women. Maybe how we don't or weren't serving younger women well. And so the system hadn't changed, in the last 20 years. And that is when I decided, you know what, I have a unique set of both professional and personal experiences that I can apply to create a solution here. Betty's Co. is a women's health company that is focused on younger women. So we serve them from the time they start their period until they're ready for pregnancy planning, really providing the care they need, and that's gynecology, mental health, and wellness, but also making Betty's the most convenient and present option for care so that they actually get care. What really makes us awesome is our ability to meet our customers where they are. And so we have nurse practitioners, physician assistants, counselors on staff, all who are overseen by an OBGYN, our medical director. We don't have a large waiting room. We're a mobile clinic, again, very intentionally designed. It's a boutique style. Our colors are specific. Our layout is specific to make we call them our Betties, our patients, our Betties feel as comfortable as possible. One of my favorite pieces of feedback from a patient was about how she came in and she loved how safe she felt by having only the providers and the staff in that location with her. And it was her first visit with an OBGYN. We specialize in first visits. We have a ton of patients who come in and it's their very first visit. And whenever I see acknowledgement from a patient that says, that was my first visit, it was not what it wasn't as bad as I was thinking it would be. In fact, I can't wait to come back. We get a lot of feedback that says, I can't wait to come back. But this one patient really calling out how the model made her feel safe. And I think if you're a woman and you're going into a vulnerable position, that's what you want them to feel. There are several instances where we have been kind of an early intervention point for women, whether that's a breast cancer diagnosis for younger women, which we have done, or identifying an underlying condition like endometriosis or PMDD, premenstrual dysphoric disorder. It's evident in those circumstances that we are kind of the first to diagnose. We are working and treating younger women. And so from just a clinical perspective, to know that we're having that kind of an impact on their lives so that they can have early treatments is really meaningful. And that's why we're doing this. For a health system like Wellstar to have its venture arm Catalyst that is out there really looking for opportunities, particularly in women's healthcare, but opportunities to better serve their patient population, is just fantastic, right? I would love to have even more health systems. I know several do, but have even more health systems really approaching it from that perspective. But then also to have them recognize how important this demographic, this kind of younger women's Gen Z female demographic is, for their the health and longevity of their patient population. That's fantastic. And it's really validating for what we're doing. And it's going to help us to grow and to develop Betty's in a way that does continue to fit into that healthcare ecosystem. So having those relationships and partnerships is really critical for our growth, and having a well-established health system like Wellstar recognize that and say, okay, yes, I want to come on board. I want to feel Betty's growth. We see value here is really incredible. I mean, we expected it, we built it to be that way, but of course, it's validating and it's going to really just help us grow even faster. My ultimate vision for Betty's is that we have a Betty's embedded on every college campus across the US, embedded in every, we'll say Forever 21 or other major place that younger women tend to go that is normalized, that we have a Betty's in those locations, because that's our ultimate mission, is to normalize women's healthcare for younger women.